So you have to put energy into it, and then it's set. And then as soon as that impulse comes along from the atria, all it has to do is tap that muscle, and bam, the muscle contracts and creates boom, makes the heart beat. Well, what happens if you don't have enough energy and you're still resetting the system when that impulse comes by and goes right by? And then as soon as it's set, it goes, oh, it went by, bam. So it goes at a different time than all the other ones do. That's what's happening. It's a lack of energy. That's all it is. It's really simple.
Hello, everyone. Welcome to the Healthy Heart webinar. We are live. We're gearing up on Facebook here. Hello, YouTubers. We're excited that you have joined us today. We're going to talk about some healthy heart things. So you're just in time. Dr. Saunders is coming from a new location today. Are you standing or are you sitting?
I'm sitting.
Oh, you are? You just look so tall. Okay. Yes. So tell us about where you are now.
Oh, it's still in Solvang. It's just like across the street. So that they're tearing down the building I was in. So they kicked everybody out, and they're gonna, I don't know, rebuild something better, stronger, faster. I don't know, whatever they call it. And so in the meantime, I moved into, actually, it's a friend of mine. She has a women's clinic. And so I'm in a women's health clinic now.
Nice. All right. So you'll be working out of that office. Who do you see when you're in that office? What's your role there?
In my role, I'm a physician. I just see patients.
Okay. So, but Dr. Saunders has done so many things, you guys. Like my mind is always blown away to these webinars because I find out all of these things from him, helping with celebrities, doing their personal doctoring. You were a director at a nursing home. You are the head guy at a medical center. I don't know. Are you president now? Is that where you were at? That's what it feels like.
Definitely. I do not have the gift of administration, so that's not going to happen.
Okay, but so you consider yourself to be a functional medical doctor. Is that what you call yourself?
No, I call myself a diagnostician because functional medicine has turned into people doing, there are some that are actually looking for the root cause of illness, and I really appreciate that. But most of them now have a program, and everybody fits into my program. And so everybody does a lifestyle program on a functional medicine practitioner. And I'm like, no, that's not what I do. And people go, oh, yeah. So this is what it, see, the problem with having a name is everybody can like put you in a box and say, this is what you do. Okay, I have no box. That's it. I have no box. So if you say, I often describe myself like Dr. House. So if you've ever seen the show House, he doesn't have like a specific, this is what I do. It's like, okay, why did that happen? Why did that happen? Why did that happen? Yeah. So frustrating watching that show, though. I'll tell you why. Because they start from the end and they work back, and then you see it from the beginning as if they're going through a process of discovery.
Yeah,
that's not the way it works.
Oh, that's funny. Well, we love having you here. Okay, I have my dog in here and she's bothering me. Okay, you need to sit. Someday I'll show you guys my dog. I have a little mini golden doodle and she tries to be on all of my webinars. But I love that you are with us each week. We actually get you twice a week, which is phenomenal. So we have this Healthy Heart webinar, but then we also have our Fixed Blood Sugar webinar, which we did yesterday. These are weekly webinars, guys. And Dr. Saunders really digs into the things that he's learning. And one of the things that I appreciate about you, not only are you looking for the root cause, but if you learn something that contradicts what you thought was true a year ago, you're willing to tell people that. And guess what? That's not true anymore.
Okay, I'll admit it. I was wrong. In fact, that came up because on my website it said like the vitamin D. So I was told that vitamin D comes out in the sweat, and then you make it, and then it reabsorbs through your skin, and so don't wash off. And he called me and he said, "Yeah, I'm telling everybody don't take a shower after you sunbathe." So that you don't wash off. And I go, no, that's not really true. The yes, it's in the sweat, but it's actually in the underneath the top layer of skin that you make your vitamin D. So
yeah, I know. Hey, I've been through this journey with you, so I get to learn and I get to see how well you handle these things when you find out the truth. And I just appreciate that about you. And I love that you're always digging in and doing the research. And so, first of all, so I don't have to, you can just tell us what to do. But I think you do also truthfully encourage us all to take control of our own health, to dig in. You can find a lot online. It used to be where doctors would laugh at us if we said, yeah, I looked on Google, but you can find a lot of information about things that have worked for others. And and there's a lot of research out there that is coming from medical facilities. So you can find good information about how to take care of yourself in other ways. And so today we're actually going to talk about something that comes up sometimes, but I don't know if we have a full grasp for it. And I hear yeah, let's just get to it. First of all, Dr. Saunders is not your medical doctor, okay? So this is the disclaimer. The things that we talk about today are for general purposes only. And so you do want to consult with your medical caregiver person before you implement any of the things that we discuss. But we're going to talk about atrial fibrillation. Did I say that right? Atrial fibrillation. Yes. What is this? What is this? It comes up all the time. I know it has something to do with the heart. Fill us in.
Okay. So when the heart beats, it has to be a coordinated beat. So you have millions of muscle cells that are contracting, and each one of them contracts a little bit. It's not that much. And if you look on the microscopic level, the molecules, how it works is there's an actin and a myosin, and the myosin has little barbs on it, and the actin has a little lever on it, and this is what happens. It goes that's how your muscles work. But it of course does it really fast. It does it like thousands of times a second. And so that's how it moves. And it's just a little movement. And that's just very. But when you add them all together, so you line them all up, and all of them do this much, then you add them all up, and the whole thing, contracts a significant amount. So you have this, all of these cells have to go at the same time. Does that make sense? That's not true of your other muscle cells, by the way. If you contract your arm muscle, you have this group of muscles contracting, and then this one will contract, and then this one will contract, and they take turns on all your skeletal muscles. But your heart is way different. Your heart, everything has to go at the same time to go and push all the blood out. So that's a different thing about your heart. So if you have all of the muscle cells working together, then boom, it's coordinated, it's perfect, your heart beats exactly the way it should, and all the blood gets pumped out, or 70% of it gets pumped out, and you got good circulation through your body, and everything looks great, right? Then what happens if some of those muscle cells don't contract at the right time? And then this one contracts, and then this one, and then this one, and then this one. Then the heart doesn't like push blood out. It goes like this. And that's called fibrillation. So fibrillation is when they're all contracting at different times. So you have this one going here, and this one going here, and then this one, and this one, and this one, this one, and they're going blah, 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 all over the place. Well, if you have ventricular fibrillation, that's the ventricle, that's the big part of your heart that pushes the blood to your whole body. Ventricular fibrillation is death. That's what people die from. When they have a heart attack, they go into ventricular fibrillation. So their ventricle just goes, and it's not pumping any blood. So you're getting zero blood to your brain, you pass out, and you die pretty quickly, right? Because there's no circulation anywhere. So that's ventricular fibrillation. And that's almost always from a heart attack. You're not getting any blood flow to the heart muscle. The heart muscle doesn't have any more energy. There's no oxygen getting there, no more energy. And so that just starts going like this as it can. Then that atrial fibrillation is the same thing, but it's in the atria. Remember, there's 4 chambers of the heart. There's 2 ventricles and 2 atria. And the atria is the little one at the top that pushes, kind of makes a last push of blood into the ventricle. So the ventricle fills up sort of passively as the blood pours into it. The ventricle fills up, and then right at the end, the atrium does a kick and pushes a little extra blood to just fill up that ventricle completely. And then the ventricle contracts, and the valve closes, and it all goes out to your body. And so it's kind of a really cool coordinated system. So if you think about that, what has to happen? Well, the impulse to contract has to start in that atrium. So you have everything fills up, and then the atrium starts kick, and then it goes to the rest of the heart. The impulse goes to the rest of the heart, and then the ventricle goes push and pushes all the blood out. So what often happens when there's not enough energy, remember that the ventricular fibrillation happened because of a heart attack and not getting any oxygen. Well, if you don't have enough energy in the atrium, the same thing happens, that you're not getting coordinated effort, and so it just starts going like this. So it has no more kick, it just goes like this. And so you get the ventricle still fills up, it's passive filling. So it's just not as efficient as it was. And so you have atrial fibrillation. It's going like this, and it just keeps going like this. But everything still works because the ventricle is still contracting to push blood to the rest of the body. So nothing happens, right? Everything looks okay. All right, well, it's not perfect, but it still works, right? There's just a little problem with that. And that is because this atrium, which is a chamber, right, has some blood flowing through it, but it's not actually emptying out. That there's some areas in there where the blood can pool, and wherever it pools, it forms clots, and then those clots kind of break off, or they're loose, and then they get into the ventricle, and then they get pumped out into your body. So what happens when you have clots getting pumped to your body? Well, they go through the vessels, and they get to a small vessel, and they go black, and they plug up a vessel. If that happens in your arm or in your abdomen or in your legs, it's not a big deal. You got redundant circulation, and if you don't have circulation for a little while, it's not gonna cause a problem, and you won't even notice it most of the time. But 20% of your blood goes to your brain, and so statistically speaking, 20% of the time that clot is going to be pushed up to your brain, and your brain does not have redundant circulation. So you plug up one of those arteries, and you got a stroke. So that's the big deal with atrial fibrillation. It's not really, it is a heart problem, but it's a minor heart problem, and nobody would even worry about it. In fact, for years, nobody worried about it until they realized, hey, all these strokes are coming from this atrial fibrillation. So they started putting everybody on Coumadin. And Coumadin is warfarin. Warfarin is a rat poison. And what it does is it makes the rats bleed to death, literally. So the rats eat the rat poison, and then they get ruptured blood vessels, or whatever, in their body, and they can't clot off. And so they bleed to death internally because they lose their ability to clot. So I did a lot of these because in a nursing home, we had a lot of people on Coumadin, right? So what we do is we would give them just a little bit of this rat poison, just a little bit, so that they wouldn't bleed to death, so that they could clot. It would just take longer to clot, so that they're not going to form clots in their atria that's fibrillating, right? So we would have to keep them at a certain level all the time. We'd check their blood every week and find out what their clotting factors are. And if they clot too fast, then you got to give them more. If they're not clotting enough, then we got to give them less. And so we're constantly adjusting the dose. And what this Coumadin, what this rat poison does, is it inhibits a vitamin called vitamin K. And vitamin K is required for a certain clotting factor, vitamin K dependent clotting factor. Um, and so if you don't have enough vitamin K, you don't clot. And so it worked great until they figured out, oh, you know what's happening? Because you don't have vitamin K, your arteries are building up a whole bunch of calcium deposits and you're getting hardening of the arteries. So this Coumadin, this rat poisoning, is causing all calcium deposits in the arteries so that they get hard, and it causes atherosclerosis. So they go, that's not really, a good long-term solution, because, pick your poison kind of thing. Are you gonna have the risk of clots or the risk of atherosclerosis? And either way, you're screwed. So,
Okay, you mentioned vitamin K, and is that not what you're supposed to take with vitamin D also?
Right. But for the same reason, people who take vitamin D or take a bunch of calcium, they have high calcium levels in their blood, and they start depositing it in their arteries, and they get hardening of the arteries. It's the same thing. So you always put the K with the D so that you have enough K, because the vitamin K takes that calcium out of your soft tissues, out of your arteries, and puts it into your bones where it's supposed to be. So that's what the vitamin K does. So
Awesome.
This Coumadin that's blocking the vitamin K stopped it from doing that.
Very interesting. This is so I found this online with the Google. You can find stuff with the Google. Okay, this is from the National Institutes of Health. So this is PubMed. This is a government site. It says that atrial fibrillation has increased by 33% during the last 20 years. Why would that be? This sounds like some lifestyle causes.
Yes, absolutely. It's an energy problem. And it's the same thing. Remember, ventricular fibrillation is because there wasn't enough oxygen getting to those muscle cells, and then they just didn't have enough energy to contract at the same time, so they were contracting at different times. Okay, so let's explain this. Remember the mousetrap. If your muscle cell is like a mousetrap, you have to put the energy into it to set the mousetrap, and then all it requires is a little tap, and bam, it goes, right? That's what your muscle does. So you have to put energy into it, and then it's set. And then as soon as that impulse comes along from the atria, all it has to do is tap that muscle, and bam, the muscle contracts and creates a boom, makes the heart beat. Well, what happens if you don't have enough energy and you're still resetting the system when that impulse comes by and goes right by? And then as soon as it's set, it goes, oh, it went by, bam. So it goes at a different time than all the other ones do. That's what's happening. It's a lack of energy. That's all it is. It's really simple. So,
what do you mean by lack of energy? Like, should we be drinking energy drinks?
Ooh, yeah, no, this is energy. This is ATP energy. This is mitochondria. This is the ability that the mitochondria have to make ATP. So in a muscle cell in the heart, 40% of that cell is taken up by mitochondria, because it is constant. Whereas most cells have one or two, except for muscle cells may have 100. These have thousands. This is like a lot of mitochondria in there, and they're making energy like crazy. Why? Because the heart can't stop. You can't give your heart a rest. You can't go, oh, I'm just going to relax for an hour. Nope, that's not going to work. Your heart can't do that ever. So it has to have that constant supply of energy. And so the way that works is having enough oxygen, enough glucose, enough fat, enough of coenzyme Q10 and all the things that bring the energy in, L-carnitine, magnesium is essential. All of these essential nutrients are required by the heart for that constant supply of energy, because it can't rest. Your muscle cells can rest. Your other muscle cells, you go, oh, I'm really fatigued. I'm going to go and rest for an hour. And then you get your energy back, right? Well, your heart could do the same thing, except you would die in the meantime. So that's not an option. So what happens is they just keep going and they do the best they can. So if it takes them instead of 1 millisecond to reset, if it takes 2 milliseconds to reset, that's twice as long because they have half as much mitochondria as they used to have. And then that impulse goes by and they go, oh, I got to catch up. Boom. And then it takes a little longer the next time. And then they're all going at different times. And it's because they lack energy. So, and that's mitochondrial energy. So taking energy drinks does not help. It might actually, if you're vitamin B12 deficient, most energy drinks have a lot of vitamin B12, then vitamin B12 is essential for the mitochondria making energy too. So that could be a way of handling it. But basically, there's 4 things that are required. And this is not my research. This was Dr. Stephen Sinatra, who is a cardiologist who's done a lot of research on how nutrients affect the energy systems of the heart. And he's shown that congestive heart failure, for example, is another way that there's a lack of energy. So it takes longer for the heart to reset. So the heart doesn't pump as much. Instead of pumping 70% of the blood out, it's only pumping 30% of the blood out. And that's due to a lack of energy as well. So the way to deal with atrial fibrillation is to increase the energy. And it's the 4 nutrients that we've talked about. Coenzyme Q10, 100 milligrams a day. L-carnitine, which would be about 2,000 milligrams a day. Ideally twice a day if you do both twice a day. And then magnesium, about 400 milligrams a day. And here's something that's unusual that we don't usually supplement in anything. It's D-ribose. Ribose is a sugar, and if you taste it, it tastes sweet. It's a 5-carbon sugar that is found in plants generally, and a lot of us don't eat a lot of plants. Our bodies can make it, so it's not an essential nutrient, but the ability to make it can diminish over time, and some people don't have enough of it so that their mitochondria can't reproduce very fast because the ribose is needed to make the DNA so that they can deoxyribonucleic acid, that ribose is required as part of it. And sometimes that's the limiting factor for them to reproduce so that you can get, back to thousands of mitochondria, 40%. D-ribose, and that would be in the range of teaspoons, like 1 teaspoon twice a day. So that is a cocktail that Dr. Sinatra says works very well to bring energy back to the heart, so that there's enough mitochondria in the heart. Now, you could add some things. There's something called PQQ, pyrroline quinoline quinone, which is an interesting kind of nutrient that tells your body to make more mitochondria, and that's all. It's just very general, not specific. Just we need more mitochondria, and so that's a useful thing to take as well. Now, having said that, remember I always tell you that the answer is not in the pills. Well, it's really not in the pills, but you may need them, and I don't know if you need them or not. So it's one of those, it can't hurt and it might help. So go ahead and take the supplements, but if you don't exercise, it's pretty useless, because you don't build anything without stressing it. You have to stress your heart, or your heart does not increase the energy production. So starting with like your slow workout, whatever it is, and building up a little bit at a time. And so if you start out, all I can do is walk from here to the mailbox, then just do that. And then each day add 1 step. And in a year, you're going to be walking a mile. Well, maybe not a mile, but pretty close. half a mile maybe. So as you're increasing your exercise tolerance, you're actually increasing the available energy. So it's kind of the ironic thing about the way biological systems work is the more you use, the more you have. It's kind of like love. The more you give, the more you have.
Good. That's good. Um, so I'm curious, I hear that so long-term stress is not good for your heart. But what about a little bit of stress? Maybe you have some big event coming up and you're excited and stressed. Is that type of short-term stress actually good for your heart?
Hmm. I don't know. I don't know. I know physical stress is very good for your heart. Question is about emotional stress. Is like releasing adrenaline or
Yeah.
norepinephrine or something. Is that good for your heart? Um, you know, I don't know.
Okay.
I don't know about being good, but it does stress the heart, and stressing the heart
Yeah.
is not a bad thing on a short-term basis.
Yeah. Okay, I want to pull up our healthy heart support. I was going to do this a little bit ago, and then someone actually asked the question about it. So a lot of you are probably already familiar with this supplement, and it wasn't created specifically for atrial fibrillation. But what do you think, Dr. Saunders? Could this be beneficial? Let's look at what is inside of this: L-carnitine, which you mentioned, coenzyme Q10, which you mentioned, and then we have the beetroot, ashwagandha, the olive leaf extract. Tell us about maybe those other ingredients. What are the benefits of those?
Okay, so those are for the stress issues. People who have an unhealthy heart for whatever reason, congestive heart failure, coronary artery disease, stress is a big factor, and it's a really big factor. It's not a small thing. And so we decided when we were putting this together not to blow it off and just say, oh, there's nothing you can do about that. We added in some things that actually help. Ashwagandha, it decreases the response. It's an adaptogen that decreases the stress response so you don't have the excessive amount of cortisol being produced. Why is that important? Because with the less cortisol, then you repair your arteries faster. So when there's damage done, you repair it better. So cortisol blocks it from being repaired. So this is something this supplement is something that's kind of different on the market. There's a whole bunch of heart supplements around, but this particular one has the L-carnitine CoQ10. Now we tried to put we're thinking about D-ribose, but we're talking teaspoons of D-ribose, right? Teaspoon twice a day kind of thing, and you can't put that into a little pill. So you're on for the D-ribose.
All right.
Yeah.
You can find this, guys, at bartonnutrition.com. Use code webinar25 and you'll save 25%. That is one word, webinar25. Okay, awesome. Let's see. I know we have a lot of questions that have come in here. Let's see. First of all, hi, Ryan. How are you? Ryan from South Dakota. He's actually on our team. I don't even know what his title is. He does a lot of really hard things on the computer. That's what he does. Important stuff. Okay. Connie is here. Hello. Gail. Okay. William says he has questions about his heart meds. Go ahead and post those in the Q&A. That's a good place for me to find those. I love someone had said, thanks for being you, Dr. Saunders. Love it. Okay, Krish, how are you? Krish is back. If plaque formation is the major factor for heart attack and related cardiac disorders and disease, why do doctors still focus on prescribing statins, which is not good medicine, as you have explained to us very clearly in several webinars? Further comments that you have would be very helpful. Many thanks.
Okay, well, the question of why, if you go to an acupuncturist, it's very likely you're going to get poked with needles no matter what you have. My wife had a shoulder problem, and she went to our acupuncturist and got needles poked in. And do you think she should be surprised? Gosh, why every time I go to the acupuncturist, I get needles poked in me? What the heck? Well, you go to a medical doctor and they're just thinking, because this is the way we're trained, what medicine can I give for this symptom? And that's the whole training in medical school. What medicine can I give for this symptom? So if you have atherosclerosis and you don't know why it's caused, why it's there, then the drug company says, well, if somebody has atherosclerosis, you can give them a statin. And that's the treatment. And so everybody agrees on that. That's what we do in our profession. And so that's what they do in their profession. It's like going to an acupuncturist. You know, you're going to get poked with needles. If you go to a chiropractor, you're probably going to get your back adjusted. You know, most of the time they're going to do that. And if you go to a medical doctor, they're probably going to prescribe a medicine. And they're going to choose whatever one the drug company says this works for this. So that's what it is.
And Julie says it seems that doctors insist on blood pressure meds and cholesterol lowering as managing it well. It's kind of
and mostly that is, this is all I have for you. The only tools that I have to give you are to lower blood pressure. Which, remember when we looked at the risk factors for heart disease, blood pressure was a very minor one. It was like in the middle of the pack. It was like number 18 out of 48. And then cholesterol was number 43 out of 48. So they're such minor risk factors that not even worth mentioning mostly. But if that's all they have, that's all they have. It's the only thing the doctor has to give you. So then they're saying, you know, take this or nothing kind of thing, because that's all I have.
Ryan has informed me, guys, that he's a software engineer. So that's what he does.
Yeah,
but
it's
I appreciate Ryan
science,
because
close.
Yeah, it's close. Yeah. when I hear that, I'm like, oh, he must be one of those people you can't have a conversation with, for me. And he's not. He's totally personable and just awesome. He's like smart, but he can have a good conversation too. So we appreciate him. Okay. Let's see here. Julie said they had misdiagnosed me recently as having a stroke or an aneurysm in my brain, blood vessels, just a couple weeks ago. So they said she had a stroke or aneurysm in her brain blood vessels.
Right.
Okay.
Right.
So
an aneurysm the aneurysm is a ballooning of the blood vessels. So an artery, for example, will have a balloon on it because there's a lot of pressure and it starts blowing up. And then if that balloon pops, that's the stroke. So that's a hemorrhagic stroke where you bleed into your brain.
Yeah. And she said I didn't have either of them.
Yay.
Yes. Yes. Very yay. That's great. Okay. So I actually was having a conversation with a friend of mine today whose dad was diagnosed with atrial fibrillation, and they said that it was caused by, well, I think she said it was kind of caused by his sleep. He did not get good sleep and was found, ended up needing a CPAP, I think. And so they used that to help control his atrial fibrillation, I guess.
Okay. Thank you. That's actually a really important. So you mentioned that it's the incidence of atrial fibrillation is increasing in the population. And so to ask the question, why is that happening? There's not enough energy getting to the heart. But the other half of that is the stress factor. So when somebody doesn't sleep, they release cortisol and they don't repair. So they don't rebuild their mitochondria. And getting sleep is very important because our anabolic metabolism happens only at night when you're sleeping. And anabolic means rebuilding, repairing. So you don't rebuild and repair if you're not sleeping at night. So if someone has like sleep apnea, that's a big risk factor for, well, atrial fibrillation, but among other things like joint replacements and stress fractures, and Alzheimer's disease, and all of these chronic degenerative kinds of problems are going to get worse and worse because normally we repair all of that stuff every night, but if you're not sleeping, you're not going to repair it. So that's really important, and that's a really important thing as to why the incidence is increasing. So first of all, our nutrition, it isn't very good. Second of all, we have more stress. I actually have a handout for this that I give to all my patients, and it is the catabolic versus the anabolic, and how do you become anabolic? And there's only 3 things you have to do. And we call it the 6-10 reset. Eat breakfast in the morning by 8 o'clock, no food after 6 o'clock, and be asleep by 10 o'clock. And that's really simple. But if you have sleep apnea, that's not going to work. So yeah, the sleep apnea machine is important.
And Dr. Saunders says that's really simple. But if any of you have tried to do the 6-10 reset, don't be fooled. It is not always easy. It seems easy, but if you're someone who's used to eating later at night, or maybe you're a night owl and you like to stay up, it takes a little bit to change those patterns, or even kind of change your lifestyle, start eating a little bit sooner. And in fact, Dr. Saunders has mentioned, I think, where did a lot of this research come from?
Oh, from Dr. Sachin Panda, who is a researcher at, I think he's at Scripps Institute in San Diego. And he did it mostly on rats. He did some human studies too. And he's just published a whole bunch on circadian rhythm and why that's so important.
Interesting. And I remember when we first started learning about this, we had talked about, it was so interesting, the timing of it, because at that time, it seemed like there were a lot of people who were really interested in human growth hormone for various reasons. The people who were kind of in this health fitness world were paying money for this, a lot of money to get human growth hormone. Yeah. And Dr. Saunders was just teaching our team about this. Like, you guys could just be done eating at 6 and go to bed by 10, and your body will naturally build that, right? And we're like, what? This is a natural thing. We don't have to pay for it. I mean, I wasn't going to pay for it anyway, but it was pretty cool.
$2,000 a month. I had somebody recently, $9,000 for a program of injecting these peptides, including human growth hormone. And it's like, wow, $9,000. And you know what? It's a short-term solution for a long-term problem. It's not going to fix it forever.
And you have even mentioned now that there's even more research saying that if you can be done eating by 3, that's even better for you.
Even better, right?
So
it was mentioned losing weight, and by itself, losing weight isn't the issue. It is having enough energy and being able to use fat for energy. And so, if you're able to use fat for energy, then you'll be able to lose weight more easily too. So, if you stop eating by 3 o'clock, and you have an empty stomach for a longer period of time before you go to bed, you have more ghrelin. That's the hunger hormone. That's the growth hormone releasing hormone. And so, yeah, it's even better. Kickstart.
You heard it, guys. There's never been a webinar where fasting has been a bad discussion. There are lots of benefits to fasting, however that looks. But you know what? I would encourage all of you guys to maybe dig into that a little bit this week. Maybe try a day where you're following the 6-10 reset, and then let us know how it goes. So that's your assignment for the week, guys. Do it as much as you can, as many days as you can, and let us know what you're noticing. I don't know how long do you think it'll take for them to notice some different things. I think you're going to wake up feeling lighter. I can tell you that's one of the things that happens to me. So think about that. Anyway, okay, so let's ask this question here from William. Oh, love it when you guys send me these big words like clopidogrel. Okay, so yep, that's what I said. He says he's on that metropolol, which I've heard of, and 81 aspirin. It's been over a year since my triple bypass. Will I have to be on these forever? Also, I was told to take atorvastatin, 80 milligrams. I have not been taking it, and my family doc says that I have to. Is there any alternative to the statins?
Okay, so your first question is, do I need to be on these forever? Absolutely not. The medications are temporary to help you get through a period. And if you take a beta blocker, like the metoprolol, for a long period of time, then it relaxes the heart. That's how it does. And it's just like your muscles. If you relax for a long period of time and you don't stress them, then you're not going to build muscle. So building back a function of the heart most of the time requires getting off of the medications. There may be a reason why you need the clopidogrel, For blood thinner, there may be some other reason if you have atrial fibrillation or something like that. And but the atorvastatin is something that is actually counterproductive to making energy, because it decreases like coenzyme Q10. That's one of the requirements for energy, and uh, the atorvastatin prevents you from making coenzyme Q10. And every cell in your body makes cholesterol, and this blocks, every cell in your body. So because cholesterol is an essential element that you can't live without. It's just and the probably one of the most useful elements you have in your entire body, because without cholesterol, you can't make a cell. You can't make any hormones. You can't have any communication between cells. That cholesterol is really, 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 really important. Did I emphasize that enough?
That's
so so don't ever think that cholesterol is bad. Cholesterol is the best thing you could have in your whole life.
This is really interesting. David says, I have a pacemaker. My Apple Watch says I have AFib. Can reading my pacemaker determine if I have AFib?
The pacemaker will have a sensor on it. So yeah, the pacemaker can tell you have AFib. The Apple Watch, though, will have a a dual. So you're supposed to have one side touch another side, and that has a circuit through your heart, so you can actually see the EKG on the watch. Yeah, so the Apple Watch can tell you if you have AFib. It'll just feel irregular, and say, yeah, your beats are really irregular. Because what happens is your atria is fibrillating, and every once in a while it breaks through and sends to the ventricle, and the ventricle contracts, and the ventricle contracts fast, and then it goes real slow, and then it goes fast and slow. And because there's no consistent beat coming from the atria, then the ventricle is really inconsistent, and no two beats are the same distance apart. And so because of that, the Apple Watch can say atrial fibrillation, but also your pacemaker could say the same thing.
Oh, great question. Okay, someone here is asking, what is the difference, or what difference is there between rosuvastatin and rosuvastatin calcium?
Oh, okay. Well, one of them is a salt. It's a calcium salt. Essentially the same thing. I don't know. Either way, it's a statin. It will block HMG-CoA reductase, which is what's necessary for making cholesterol. But also it's necessary for making all of your hormones, like testosterone and estrogen and progesterone and pregnenolone. All those are necessary, or need that enzyme as well. So it blocks those from being made. So rosuvastatin is still has the same issues as atorvastatin.
Medicine is very powerful. I mean, just talking through some of these, what they actually do, it's a miracle, but it can also do some damage if not monitored well or prescribed well, which is really scary. So these are really good questions, and just a reminder for us to always be looking into these things. I love that people are saying, do I have to do this forever? It seems like Dr. Saunders has mentioned that when a lot of things were created, they weren't meant to be taken forever, but now that's just what we do. We just take them forever.
Yeah.
Okay. Connie said, could you very simply tie diabetes causing or affecting heart disease? Is there a correlation?
Oh, absolutely. So think about it this way. What were we talking about with atrial fibrillation and even ventricular fibrillation is a lack of energy. Energy is the key. That's what life is. Life is the ability to make and use energy. And so if you can't make or use energy, then you can't live, whatever that is. If you don't have enough oxygen to make energy, then you're going to die. If you don't have the right enzymes, if you don't have the right nutrients, whatever you're missing, if you can't make energy, you're going to die. So how does diabetes affect? Well, diabetes is all about metabolism. It's all about making energy. And so a normal metabolic process in the body. So your body should be using about 60% fat and 40% glucose for energy on a daily basis. You should have about that going all the time. If you have type 2 diabetes, you have limited fat ability to use fat because insulin is really high, and insulin tells your body don't use fat for energy, use sugar instead. So then you end up having a high glucose metabolism and a low fat metabolism, and that's unstable. That's not consistent, and it causes a lot more oxygen-free radicals, so it does a lot more damage. So you're damaging the mitochondria by having all that high octane fuel in them. It's kind of like, you take your diesel engine and you pour gasoline in it just because, you got to have something to run on. Well, if you put gasoline in a diesel engine, it's not going to run very long because you're going to wear it out very quickly. It's going to overheat and you're going to have problems. So you need that low octane fuel to run properly, and that's the fat. And so with diabetes, you can't run on fat. You have very little fat metabolism and a whole bunch of sugar metabolism. So your sugar's always constantly high. So that affects the heart. The heart won't get enough energy because you're going to lose mitochondria as well during that time, and you're just not going to have enough energy in the heart. So that's what the L-carnitine does. When you add the L-carnitine, that is a carrier that carries the fat into the mitochondria so the mitochondria can use fat for energy. And so Dr. Steven Sinatra found that L-carnitine would help. Why is that so important? Well, because during diabetes, or in the case of diabetes, you have limitations in your ability to use fat for energy.
Good. Okay, Kevin or Johnson's, if you guys are listening, I like what Dr. Saunders said about filling up the car with the wrong kind of fuel. It'll work for a little bit, but not very long. And so I feel like that was a good visual for me of when you make poor food choices, if you're struggling and you feed your body with poor food, you don't get to function for very long in a good way. So that's good. See, all of your little visual aids help so much, Dr. Saunders. I appreciate you so much. Okay, here we go. So many questions. Great question here from Aubrey. Do small brain bleeds caused by a fall repair themselves?
Most of the time, yes. So it depends on where it is and how it's bleeding. So sometimes, like, people have a fall and they get an internal bleeding. And if it's subdural, which means it's underneath the real thick membrane around the brain, if it's inside the brain area, then the blood can leak in all over the place. It has a lot of places to go. And it can keep bleeding for a long time. Or if you re-injure it. That's why when people have like concussions, they go to a concussion clinic and they say, okay, you can't play football for 4 weeks because you got to give this time to heal. And is that a good precaution? Well, if you re-injure it, if you have I don't know, a scab on your arm and you keep picking at it and it keeps bleeding, and then you put scabs up and then you pick it and it bleeds again, and is it ever going to heal? No, you've got to give it time to heal. Put a Band-Aid over it, wrap it so you don't pick at it. I have to do that to my kids sometimes, and my dog too. I got to wrap his foot sometimes because he'll just keep going at it. So in the brain, you're not going to be able to like wrap it. So what are you going to do? You're just going to be really careful for a while and not bonk your head against the wall anymore.
Sure. All right. Good question here from Sally. My daughter works evenings from noon to 10. So is she not able to repair her body? Because she can't get to bed by 10 or stop eating. So
yeah. Oh, I see that. And I see that all the time. In fact,
you especially, you're seeing a lot of nurses and stuff too, I suppose, that are doing overnight. You probably have your doctors that are doing the same thing.
Yeah. In fact, I just had somebody the other day. She's a nurse, and she works till 10. She was working till 11. Now she works till 10. I said, can you move it back to 9
Yeah.
so that you can get home and get in bed? Because I said, you're not going to eat at night anyway. And so, and she said she thinks she can just move it back to 9 to take off an hour early. But the answer is, it's better to get to bed by 10 o'clock. So working till 10 is a problem. They did this study with police officers. And when they're on the evening shift rotation, they don't get home till 11 o'clock or midnight. Then they don't get anabolic and they don't repair their bodies, and they're aging. But then when they're on the day shift, they can repair their bodies and they do better. Nurses, the same thing. Even the ones that said, oh, I love the night shift. It's quiet. It's a lot better. I just love it. And I sleep better during the day. Well, guess what? When they test them, they don't get anabolic. They're not making that human growth hormone. They're not repairing their body. And so, and I actually had a nurse, like you were talking about, who was working nights for a long period of time. And she said, gosh, I just feel like I'm 60 years old and I'm only 35. And I'm like, yeah, that's what's happening. You're just aging because you're not repairing every night.
We probably need to do a webinar on sleep. I'm thinking all the benefits of sleep, what happens when you sleep. Here's a question from someone that says, I'm making myself go to bed before 10, but I only sleep for 2 hours. Is anything beneficial happening in that 2 hours?
Yeah. Yes. As a matter of fact, yes. In fact, if you were to have like a sleep monitor, you would find you probably get deep sleep. But sleep is a habit. And so making your sleep habit, and look up on the internet, look up sleep hygiene. And you're going to get thousands of websites on sleep hygiene and what that is. And all it is making a habit of sleep so that you have regularity. And some of them will say you have to go to bed at the same time every night. And some of them will say you have to wake up at the same time every morning. It doesn't matter what time you go to bed. And so they're not consistent in that because not everybody's the same. But one thing you have control over is what time you get out of bed in the morning. So if you say, okay, I'm getting out of bed every morning at 6 o'clock, and I'm going to go to bed every morning, every night at 9 o'clock, and then you go to sleep and you sleep 2 hours and you wake up at midnight and you go, what the heck? Yes, it's still good. Just it's okay. And you know what? If people freak out and they get all anxious because, oh no, I'm not getting back to sleep. It's okay. Just like let it go. Just lay there and think about something that you love a whole lot. And you know what? If you're awake for an hour, it doesn't matter. Human beings. If there was a a book written on sleep, and they talked about how there was in the old days there was first sleep and second sleep, and nobody knew in the modern times what that meant. But think about it. If you don't have artificial lights, then you can't just flip a light switch and read a book. What do you have? You have candles. And what if you can't afford to like burn 100 candles in your house all night long? You're going to blow out the candles. It's going to be dark. So what happens is when it gets dark, people they make melatonin and they start going to sleep. Well, then they wake up at midnight or 1 o'clock in the morning or 2 o'clock in the morning, and they've like slept for 3 or 4 or 5 hours, and now what, kind of thing. And so they would be awake at night, and that was a common thing. And people would go out and do mischief, and that's where they were written up, as mischief that happened between the first and second sleep. And that's when the farmer's daughter got pregnant, and that's when a pig got stolen from the next door neighbor, all those kinds of things happening in the dark of night. Well, but then people would go back and go to sleep, and they'd sleep for another 4 hours. So they have like 4 hours, and then they'd be awake for 2 hours, and then they go to sleep for 4 hours again, and then they wake up when the sun comes up, that kind of thing. You know what? It's okay to separate your sleep like that. That is actually a normal human experience. And that's, for thousands of years, that's the way human beings lived. So, we have I'm going to be in bed for 8 hours and that's all I get kind of thing. And it doesn't have to be that way.
Guys, these are such good questions. I think we do need to do a webinar on sleep soon. We'll dig into some more of this and the different sleep cycles. I know that Dr. Saunders has been monitoring his sleep. Are you still doing that? Are you still monitoring
Yeah,
your
I
watch?
got my watch.
Okay.
Yeah.
Yeah. So he's probably finding out all sorts of crazy things. He's probably
You
finding
know,
out that he actually doesn't sleep that much, I bet.
yeah, that's it. Yeah.
Yeah.
So if it makes you guys feel any better, I'll show you my sleep. Okay, so this last night was good. I was 83, but you can see the last week how that on the 29th I had 8 hours. The rest of the time I'm near 6 hours, 7 hours, 7 hours and 4 minutes last night, and that was a good night. But most of them I get are fair and not good. So because I don't sleep long. And let me see. Deep sleep last night. Ooh, deep sleep was really good. I got 46 minutes. Sometimes I get like 7 minutes. I don't know why.
Wow. Very interesting.
I just blame it on my dumb watch.
Yeah, it's the watch's fault. All right. Okay. Aubrey said, what do you think of red yeast rice as a supplement?
Thank you for asking that. Okay. Okay. So red yeast rice is a statin. And that's all it is. So there's nothing magical about it. It's just a statin. It decreases your cholesterol production. It's okay, but you know what? There are better ways.
Interesting. Never even heard of it. So, all right, guys, let's see. Do I have any other questions that came in here? I might have missed a few things in the chat. Give me a second. Okay. Another name that I don't know. Ezetimibe. Ezetimibe. Okay. Is it a non-statin? Is that okay?
No, it still has the same issues. The same issues with lowering cholesterol in not a natural way. If you lower cholesterol because of the way your diet is, your cells can still make it. So each of your cells is making and using cholesterol. And yeah, you're going to have less in your blood, and that's okay because your liver's not making a bunch to put it out in your blood. But if you're taking these medications that block the production of cholesterol, then that's affecting your cell's ability to make cholesterol. So your immune system doesn't work as well. Your hormone system doesn't work as well. They don't talk to each other as well. And they've shown that cholesterol medications, as they lower cholesterol, they lower things like testosterone. There was a study on testosterone. As the cholesterol went down, the testosterone went down right with it. So, no, you know what? We talked about this. Go back to the webinar on cholesterol. Normal cholesterol is 240. That's normal cholesterol. That's the perfect level of cholesterol, 240. So that's where you want to be.
Yes, definitely check that webinar out. You'll see why he says that. It's very interesting. And we'll talk about that in a minute. I'm going to ask you one more question before you take off, Dr. Saunders. Cecile says that when her blood sugar is, when blood pressure is low, her sugar is high, and vice versa. What's the correlation?
Oh, that's interesting. Blood pressure is low, sugar is high. If the sugar is low, the blood pressure goes high. I don't know. Okay, so blood pressure is controlled by the brain, essentially, the autonomic nervous system in the brain. And if you have low blood sugar, then the brain is saying, hey, I'm not getting enough energy here. I need more pressure. And that's the only way that the brain has of controlling its nutrient supply, whether that's oxygen or sugar or whatever, is by increasing blood flow by raising blood sugar. So that would be my best guess.
Okay. They're correlated.
Yeah.
They're talking. That's how they talk to each other. Right? Is that what you're saying?
Yeah.
Okay. Awesome. Thank you, Dr. Saunders. You're the best. We'll see you
next week. Bye.
All right, guys. So bartonwebinar.com, there's the hub for all things related to these webinars. If you want to go back and find past webinars, you can find a link to our YouTube channel on that site. If there's a specific topic that you know you're interested in, like maybe you want to learn more about the 610 reset or fasting or the cholesterol that we were talking about today, you can go to our channel and then search for that in the search bar, and you will find all of the webinars where we have talked about that. So over 200 and probably close to 230 webinars that we have done. And so tons of information for you guys. Yeah, anyway, you can also use code webinar25 and you will save 25% on anything that you purchase there. Webinar 25 is one word. Okay, I think that's it for us today. Come back next week. Wednesday, we do our webinar on type 2 diabetes. And then, of course, Thursday at 12 noon Central Time is when we do this webinar. They're free. Dr. Saunders does these. They're about an hour long each. And we always open them up for questions for you guys, which I think is just completely invaluable. I don't know another place where you can do that for free and talk with the doctor. So invite a friend. If you know somebody who could really use this information, tell them to go to bartonwebinar.com and sign up for these webinars. That's it for me. Thanks for hanging out with us, guys, and asking all of your great questions. I love learning from all of you. This is just a great space for us to do a lot of learning and chatting together. So we'll see you next week. Thank you, guys. Be blessed. Bye-bye.